for most New Zealanders, if given the opportunity to understand and comprehend how their behaviour or how their approaches or how their thinking is detrimental to the health and wellness of others, generally will come on board. For those, however, that are a bit more determined to stay in darkness, that's more challenging. And unfortunately, I know in our country we will have a small group of people that sit in that space. But for most part, I think that all New Zealanders want to see all New Zealanders do well. Obviously, the challenge for us is to make sure that the do well part is defined in a way that is meaningful for all cultures, or, as I'm talking about today, for our whānau Māori.
E ngā pū eo rau o te tautara haimata. O tō tātou nehe nui, tēnā koutou. Nau mai ki tēnei, ko nai ipurangi, ko ao Mai Te Rā tēnei. Welcome back to this podcast series where we talk about racism in all its forms and talk about the ways in which we can get rid of it. With us today, he uri tēnei no Nai Tūhoi, no Ngā Tika Hungunu, no Tonga Hoki. Welcome to our podcast, Riki Nia Nia. Wonderful to have you with us.
O tēnā rā koe te tuahine, tēnā tātou ki te hunga I mā takitaki mai te rā nei. Nō rea tātou katoa tēnā koutou.
Kia ora. So Riki, you've got a vast experience across DHBs, in men's mental health and suicide prevention. And I'd be keen to for you to share your insights around how we actually begin to unpack talking about racism to start with.
Kia ora. So I've been working, I've worked for 10 of the 20 district health boards in this country. I've been working in the health system since 1997. So you could say I've pretty much seen it all, and unpacking it while challenging is definitely something we need to start thinking about doing or doing more of. I think a good way to start though, or to think about, because there is still a question about, and some people, there's an argument about, are we talking about bias, unconscious bias or racism? Where I like to start with this conversation is actually at a systems level. So if you think about our current health system and you think about what's important within our health system, because ultimately any system values and illuminates what's important to it. So if you start with the workforce within our current health system, across Aotearoa New Zealand, 93% of the workforce is non-Māori. 7% is Māori, and as a matter of fact, if you look at the Asian population, not that this is a criticism of the Asian population, there's actually more Asian people working within our health system than there are Māori. So you could argue that you're more likely to get a role within our health system in Aotearoa if you're non-Māori than you are Māori, just based on looking at the workforce statistics. Then if you start to dig a bit deeper and you look at the outcomes that our health system is producing, you will see that for Māori people in particular, they don't access primary care as often or as much as other ethnicities. When they do access different services, they are less likely to get the same level of treatment. And then when you dig deeper and look at health outcomes, for example, if you're looking at post-surgery, our people, again, this is all information that is published in official documents across our country, are more likely to die post-surgery than any other ethnicity in the country. Our people are more likely to have cancer, but less likely to be able to access the diagnosis, to access the treatments, etc., and so on. So you could say then that the health system is largely staffed by non-Māori, but also works really well for non-Māori. Now, there's a number of ways of looking at that. One way you could say is that the health system works really well for some parts of our population, but not for others. Another way you could say, you could think about that is that we have a racist health system. Whether you want to describe it as conscious or unconscious or racist, it doesn't really matter. The fact is that the proof is in the pudding when we examine at a systems level, at a strategic level, how our system is operating for the population of New Zealand, or Aotearoa. Now, one of the things I would say about that is, I think when we start to illuminate these sorts of findings or these sorts of outcomes to the general population of New Zealand, no New Zealander or person that lives in Aotearoa would be happy with that. I think, 80% of most New Zealanders are good people. And 80% of most New Zealanders, if they know that there is an injustice occurring, will want to see change occur. Of the remaining 20%, 80% of those with some encouragement, with some sharing of insight, knowledge and intelligence will also, come on board and want to see change. Because for most part, people living in this country do have, in my view, a level of commitment to justice and doing what's right. The issue has always been is that we've starved our people and our population in this country of the knowledge and intelligence in and around what's important in our country, and not just te ao Pākehā, but te ao Māori as well. And so the challenge for us, and it's good to see that we are seeing some progress in this space, is that we are now starting to expose the total population to the things that are important in our country. Now, what am I talking about? So, for example, our reo. Our reo is really important. Our reo, our language, our culture, our waiata, the way we do things, and most especially our tikanga. But of course, there hasn't been an appreciation of those things because, again, within our education system, they're not valued. And the way that what we teach in our education system are the things that we value, which are by and large driven by a te ao Pākehā way of thinking. Now, there's nothing wrong with that. It's just that if you only ever present that to our population or to our people, you're only giving them half the story. And therefore, they're only ever going to be able to see things for example, a te ao Pākehā way. And they're also only going to be able to measure what's useful, what's valuable, through a te ao Pākehā lens. So part of the challenge for us in order to lift, I guess, the burden of racism in our country is to start to share and expose the whole country to our intelligence.
And what are the fundamentals of that, as far as you've seen in practice? Where do we get some sort of evidence of shift? Yeah, the fundamental levers, I suppose, is what I'm asking about.
Well, first and foremost, with anything, in my view, in terms of our culture, in terms of our language, in terms of our tikanga, our people have to value it first. It's a bit like, you can't expect people to value something you don't value yourself.
Kia ora.
And, from my perspective, and again, I'm not getting at our people, because why would our people value our culture when through colonisation they've been told that our culture isn't worthy or that our culture isn't useful to them in New Zealand or within and across the world. So why would they value that when it's been beaten into them that it's not valuable?
Exactly.
So I can understand why at times our people don't value our culture. But when you look at examples in contemporary Aotearoa New Zealand society of our people valuing our culture, it's amazing. I had the great fortune a couple of weeks ago to go to the Te Arawa Secondary School Kapahaka competition. And, you can see there a valuing of not only tikanga, reo, waiata, kapahaka, whanaungatanga, all those things that are integral to our culture, the difference it makes to our young people, our rangatahi, the ability to stand confidently with identity, with pride, the ability to be able to use our reo, the ability to understand their whakapapa and also our history, but not turn away from our history, but celebrate it, and celebrate it on the stage for the world to see. And all of that, in my view, is, if you like, is a demonstration of excellence in the application of our culture. But more importantly, it's healing. It's not only healing for our whānau and our tamariki, it's actually healing for everybody in this country if they're given the opportunity and if they give themselves the opportunity to embrace it.
So isn't it interesting how the things that are defined as health services that are there to promote healthy outcomes for our people generally don't have at the heart things like kapahaka, wakaama, knowledge about our lands, our whenua, our kaitiakitanga. These things are seen as separate and not preventing suicide and not promoting well-being from a hauora perspective in the way that those contracts are constructed. So talk a bit about your reflections around that kind of tension or that interface as you see it.
Kia ora. We'll never achieve oranga in this country until we start embracing a te kaupapa Māori perspective of wellness. It is one of the reasons also that I am cautious in the use and application of issues or kaupapa or concepts like equity. Equity, for me, I would describe as the kaupapa Pākewhification of Māori health. And why I say that is because equity, and I'm not saying equity is not important, because equitable health outcomes for our people are important using clinical markers. But equity is still very much a kaupapa Pākehā perspective or worldview of what wellness or health and well-being looks like. And for most part, the markers are based on, the biomedical Western perspective of health and well-being, which are largely deficit and disease focused. But as we know, what makes us good, what makes us feel good as people, as being with our whānau. What makes us feel good as parents, is seeing our children succeed. What makes us feel good as children, knowing that we've got a home to come home to and that our, there's kai on the table, etc., without wanting to oversimplify it. But the fact is that, from my perspective, I don't have an issue with equity as such being used, but we have to be careful because it is also another, if you like, enabler of enabling or privileging one way of seeing health over another. Now, if you look at health and wellness from a kaupapa Māori or te ao Māori perspective, it's quite different. What wellness looks like to me, for example, and I just shared an example, was seeing our young people up on stage, embracing our language, our culture, our waiata, and standing true in their identity and knowing who they are and being proud of it, and not allowing that narrative that tells them that they're inferior, that some of us have grown up with in this country because of things like colonisation, etc., and racism and bias and all those other things. But actually seeing them stand proudly in their identity shows me that, the answer from my perspective to the health and wellness or the oranga of Māori people in this country, and actually all people, is in our culture, is in those cultural values, beliefs, tikanga that, our ancestors have our tūpuna have handed down to us. We as a country though, or as a people in the first instance, just have to start valuing it that way. And
I suppose the kupu Māori that we use, the names of things, and particularly the name of our country, has become a bit of a hot point. And we've seen a considerable amount of pushback around that at the highest levels. So I'd be interested to hear your thoughts about the kupu Aotearoa and how that works for the young people that stand on the stage, the atamira at various regional kapahaka champs, and demonstrate to us that whakatinana here of tuakiri Māori. And for them, wouldn't it make sense for us to call our country, to reclaim that kupu Aotearoa rather than calling it New Zealand? How do you see that?
Yeah, no, tautoko tuahine. I mean, from my perspective, it's already named Aotearoa, so all we're doing is acknowledging that, whakamana te reo rangatira I roto I te whenua nei. So we're really just acknowledging that, although I think others are having a different debate about which one we should use, and I you know, the sad thing about that is that we have a number of people who don't have or haven't had the privilege or the opportunity to learn that reo, and so therefore don't understand the depth of meaning within our reo. And that saddens me because, again, I believe there's healing within our reo and the depth of understanding that comes with it. Also, if people were to give themselves the opportunity to understand, I think you will find that they will embrace it. An example recently is that as our country works our way through this pandemic, COVID-19, recently we opened at Te Awa the base in Kirikiriroa in Hamilton, the largest vaccination centre, and we did that in partnership with Waikato Tainui, so it's on Waikato Tainui whenua at the base. And at the front entrance of that new vaccination centre, which will be vaccinating 1,000 people a day, it has Kingi Tū Heitia's tongikura, Amo hea ake te ora o te iwi, ka puta ki te whaiau, which is let the health and well-being of our people always be paramount. Now, that's relevant not only to te ao Māori, that's relevant to te ao katoa, to all of us. And what that means by having something like that at the forefront of that vaccination centre or our response in the Waikato to the vaccine, it means that we must find every way possible, if we are to stay true or hangai our mahi to their tongikura and to whakamana the kōrero, the arahi from Kingi Tū Heitia, we must find every way possible and unturned every stone possible to vaccinate everybody, not just Māori, but everybody in the Waikato, within the different priority groups and across our community. So I guess why I'm raising that, and I know this started off as a kōrero about Aotearoa versus New Zealand, is in our kupu are also values. And in those values, why they are aligned to a te ao Māori way of thinking, they are actually beneficial to all people and all people within New Zealand society or within Aotearoa. But as I said before, the challenge is that we haven't fully embraced or taken the opportunity as a country through our education system to expose Māori and non-Māori to the beautifulness of being Māori. And the beautifulness also of the Māori culture, not just for Māori, but for everybody.
Kia ora. And at the same time, we get accused of ramming our beauty, our amazing culture from Te Ao Māori, we get accused of ramming that down the throats of Pākehā people who reject it utterly. How does that kind of racist pushback, how do we try to turn that around?
Yeah, so I mean, if I was now to be practical and to be deliberate and intentional, I mean, someone said to me the other day, how do we reduce the number of racists we have in the health system? And my response to them was simple: stop hiring them. I mean, we overcomplicate things at times. I mean, when somebody comes in to work in the health system, a hospital or wherever, we ask them heaps of questions about whether they're clinically capable or non-clinically capable, whether they're this, they're that. But we should also be screening to see whether or not they are people who actually value the role of working and caring for people in the way they deserve to be cared for. And also making sure that they're not racist. I mean, we've got a screen or a filter or an assessment for almost everything these days. I just think, from my perspective, we just need to be more deliberate and intentional. Now, for those who are already in the system, obviously that's not going to work. But my view is that for most New Zealanders, if given the opportunity to understand and comprehend how their behaviour or how their approaches or how their thinking is detrimental to the health and wellness of others, generally will come on board. For those, however, that are a bit more determined to stay in darkness, that's more challenging. And unfortunately, I know in our country we will have a small group of people that sit in that space. I think that's we're just going to have to start to karakia for them, because that's a more challenging group to move forward. But for most part, I think that all New Zealanders want to see all New Zealanders do well. Obviously, the challenge for us is to make sure that the do well part is defined in a way that is meaningful for all cultures, or, as I'm talking about today, for our whānau Māori.
And you know the DHB sector well. These are conversations that people like us have been trying to have been having for many, many years. And the conversations are not easy. So what are some of the runs on the board, if you like, or some of the wins that you've had to help maybe other people watching or listening to refine how we can more effectively talk about racism itself, and help people maybe identify ways that they are enabling racist systems without realising it?
Yep. So I'll just share a really good example the other day of a colleague who came to me when I first started working in the Waikato, and he said to me that he had been challenged by one of his registrars, and that person had done analysis of who they had been providing historically, the services they were providing to. And what she said to him was, basically you're providing services mainly to middle-aged white men. But the issue, if you look at it from, look at the health data, is mainly amongst Māori men. So the services you're providing are not hitting the mark. Now, he could have reacted in a number of ways around that. He went and had a closer look at the data and realised that actually she was right. And so now he has become, just through the illumination of that inequity and the illumination of the unjust or unfairness, or the non-responsive way in which they had been scheduling surgery or their services, he has become a real champion to ensure that where the need is, the services are provided. So now here we are just starting, for example, a new service in the community, outreach service, to make sure that there are unhindered pathways of care, in particular in this instance for Māori men, because that is where the data tells us the issue is, to the care they need. Now, that shows me that, obviously one way in which to move people out of the darkness, I'd like to say, or to illuminate, some of the negative outcomes of the decisions that they make, is to share data with them. I mean, obviously that doesn't work for everyone, because we've got lots of data in the system at the moment, and we've shown that the system can improve in a lot of places, but we still don't necessarily get the commitment that we would expect to see for a system who's striving to achieve excellence. And that's the interesting thing about our system, is that, our system, the health system, will never be excellent until it responds effectively to those parts of our community that are most in need. And in this country, we know that is Māori, Pacific, and other parts of our community as well. We've also, tried to, we're working hard to change the culture of our organisation. So, what I've said to my team, for example, is that we still want to be challenging, but we want to do that in an uplifting way. So illuminate to people what the issues are, but then provide the solution as to how they might fix it as well. The amazing thing that's happened within our District Health Board over the past 12 months is that we've increased our Māori workforce by 100, and I know this is not an advertisement for Waikato DHB, but you asked for concrete examples, and this to me is a real indication of our our changing, slowly changing the culture to be one where people want to actually, be in or work within. We've had 100 new Māori staff come and join us in Waikato, 150 actually, over the last 8 to 12 months. I've never ever seen that before in my life. Now, there might be lots of reasons for that. In that time, 50 left as well, so a third of the number that started. Again, that's quite amazing. That's quite amazing because what I've witnessed in the last 20 years is that we might get 100 Māori staff, but the real issue is holding on to them, and we normally would get 100 leave at the same time. And so what that also tells me is that culture change is required, where we're changing to a culture of, yes, we need to challenge ourselves to do better for the health and well-being of our people, but we need to do that in an uplifting way. And I think, from a culture change perspective, the biggest advertisement, for example, to get more Māori working in the health system is actually the Māori who are currently working in the health system. Because, if Māori leave a place unhappy, they're sure to tell everybody that, don't go and work there, that's not the place to work. Equally, if Māori are feeling like they are supported, they are being supported to care for their whānau in the way they deserve to be cared for, if they are supported to meet their own professional or whānau or te ao Māori aspirations, then they're more likely to stay in a place. And so from my perspective, changing the culture within an organisation to become more te ao Māori embracing and valuing te ao Māori values and concepts, but in a way that is uplifting for everyone, will also, change the culture within an organisation that will help us deal with some of this historical bias, racism, unconscious, conscious, however we want to describe it. And the final thing I'd say is, we do have to be deliberate and intentional with the way we recruit staff. We also have to be deliberate and intentional with setting clear expectation for staff. It's not okay. It's not okay in any way, shape or form to treat people poorly for any reason. I know that in some instances in my time I've seen mechanisms put in place, for example, for being able to report bullying in an organisation. And it was interesting in this particular organisation, I won't say which one it was, is that I asked them, okay, so we've got this mechanism now, we've been proactive, we're going out, we're wanting to support all our staff, any staff, regardless of what ethnicity they are, to be able to report bullying, because bullying is not acceptable for any culture, for anybody, any staff member. It's not the culture that we're after. I said, yeah, and I said, oh, okay, so is this also the mechanism that we would report racism through? And the response I got was, oh, hold on, I need to go and check, because we just need to make sure that they're able to receive these, racist complaints and or feedback or from our staff. About a week later, she came back and she said, no, this isn't the mechanism that we can use. We're not ready to receive complaints of racism. Now, to be fair on her, I think she was thinking she was doing the right thing, and I'm not getting at her or that organisation. But what it shows is that, because racism is the worst form of bullying. There is no worse form of bullying than in my view, than racism. Is even when it comes to reporting something like racism, there's barriers. And so, well, I guess that it is a lesson though, because what I've also seen is that where whānau in the past have, who are on the workforce or who are in the community have reported racism, I've also seen it turn around so that it looks like actually they're the issue, not the people that have been racist to them. And so that is another lesson that we need to take on board as a country or as these organisations working across Aotearoa, is that we need to make sure that, one, we have mechanisms in place to report what is very unacceptable, racism, but we need to be able to receive and respond to it in a way that doesn't further worsen the experience or the negative impact on the victims of racism. So we've got a bit of work to do there still, I think. But it's fascinating. It's never ending. Yeah.
Yeah, it is interesting, that dynamic, similar to bullying, whereby the person being bullied can often be the one who's then made responsible or accused of being the person who caused the bullying in the first place. Yeah. The victim blaming whakaaro. And in a similar way too, you mentioned about data and evidence. You know, many of us over many years have been, okay, we've been collecting data, we've been collecting evidence to demonstrate how and where and by what means these kinds of disparities which are caused by racism manifest. Because that's what Pākehā systems ask, right? Show us the evidence. But actually, even when you provide evidence, the change isn't always the next thing that happens. So I'd be fascinated to hear your reflections on that, or any examples you've experienced of that.
Yeah. Listen, I have to say that our country ignores the evidence when it comes to Māori, our people. I mean, the evidence tells us that, for example, if we're immunising, that, and again, I'm not getting at primary care, but if you look at immunisations of Māori versus non-Māori through primary care, it's very poor. So we know that if we only ever rely on primary care to deliver immunisations to our whānau, it's never going to happen. And yet, you know, we still, have a strong reliance on primary care. So we're ignoring the evidence that can't be the only way to deliver something like immunisation to our whānau. And that is something that does sadden me, because we have to ask the question, why is it that we ignore the evidence when it comes to our people? But when it's relevant to other cultures and or ethnicities in our country, we seem very quick to respond. And I know it's complex, but those are the things we need to illuminate as part of this conversation. And as I said before, most New Zealanders, in my view, would be unhappy about unfairness or injustice occurring in our country. But they have to understand and also be given the opportunity to understand what's going on so that they can become part of the solution. Because we need all New Zealanders to be part of the solution. It's not a Māori issue. This is a New Zealand issue. This is squarely a New Zealand issue as opposed to an Aotearoa issue, in my view. So yes, I mean, I agree. The evidence on its own is not enough. We have to be very deliberate and intentional in stomping racism out of our system, for example, within the health system, within our society, etc. And that's why I keep saying, and I know it is a little bit in jest, but it starts with stop hiring racists. I mean, if you stop hiring them, then they can't work in our system. But we've got to be very deliberate and intentional about that. And the other part of it is stop tolerating racism within our system. Stop protecting racists. Stop, further victimising the victims. We've got to be very, very deliberate and intentional in our response to racism. But equally, one of the things that I would caution us about, though, is that actually there are also lots of New Zealanders who are wanting to do the right thing and who are wanting to be the difference, and we do have to support them as well to be champions in that space.
Kia ora.
Because we can't, just, for want of a better word, tar everybody with the same brush. I know, lots of very, very good non-Māori people who are committed to making a difference to the health and well-being of whānau within our community, who have dedicated their lives to make that difference, and who are very open-minded about how to do that. And so, we just have to be cautious that we don't, mistakenly lose some of our allies in our quest to be deliberate and intentional. For example, in the past I've always put in place in the different DHBs that I've worked in the opportunity to call all Māori staff together, and part of holding on or retaining our Māori staff is showing us that we value them, and part of valuing our Māori staff is to hui Māori. So, I've always done that. But I've also opened it to not only our kaimahi Māori, but also to our kaimahi who are champions for paiora, or manaakitanga, or tikanga Māori. And the reason I've done that is for that very reason. We need people in the waka, and we need people to support us in our quest to make our country a better place. While I'm focusing on health, really what it's about is, in my view, is making our country a much better place for everybody. We won't get there, though, until we start supporting and embracing some of the taonga in our country, which are most definitely within Te Ao Māori.
Ka pai. Nei a mihi ka ririki a koe te rangatira. Kia ora te whānau. Lots to think about from this podcast, and I hope you've enjoyed it, and talk about it at home with your own whānau. If you'd like to know more about this kaupapa, check out our website. A tōna wā.